Well, Brian, as those case numbers continue to go up, contact tracers are staying pretty busy, but some actually are in the process, or question the process, if it really works in order to stop the spread of COVID-19. How effective is this contact tracing? Well, 8 News Now reporter Kristen Drummond joining us now live from the newsroom with the latest on the efforts, but also the challenges. Kristen?
Well, Denise, contact tracing requires investigating to understand the spread of COVID in the community. It seems to work best when everyone participates and is forthcoming with their information, which presents an issue at times. UNLV created a contact tracing program in partnership with the Southern Nevada Health District this year. Roughly 200 students work part-time making calls to people who tested positive and their close contacts. The professor overseeing the effort tells me it's successful but offers certain challenges. That includes people not answering their phones or refusing to share names or phone numbers. Now, when this happens, it can either delay notifications or some people may not even know at all about their exposure.
We have to rely on them to provide that information so that we can protect the people around them. It's not to get somebody in trouble, it's really to intervene in that disease transmission process so that they don't spread it to somebody else.
Professor Labus adds when the virus spreads quickly, like right now, contact tracing is not as useful stopping the virus transmission, and that's because it can be difficult to reach everybody and intervene, but it remains helpful when cases get under control so more people get alerted. Now, contact tracing is responsible for about 25% of diagnosing exposure. One way to possibly know your exposure right away is by downloading the COVID Trace Nevada app on your phone. It exchanges information with other phones nearby to alert if you have come in contact with someone who's tested positive for COVID-19. Roughly 122,000 people have downloaded it so far, which is about 4% of the state's population. So for it to really be effective, according to the State Division of Public and Behavioral Health, 15% of the population need to have it.